Kirsten, hello.
Hello?
I reviewed your daughter's X-ray and CT scan images. She has the condition called craniosynostosis, which we suspected. The images show that her suture is fused prematurely.
Okay.
What happens is that, baby skulls have openings that we call sutures, which allow the brain to grow. The brain triples in size after the first year, and it continues to grow until they're 12. Tell me more about those symptoms.
She cries all the time. I consulted 5 or 6 doctors, but no one really helped.
Mm.
They said I should let her cry, and I shouldn't spoil her, but I was sure something was wrong. She's in a lot of pain.
Yeah. She has the condition craniosynostosis, but her head shape is almost normal, so it's probably harder for doctors to diagnose. It's a complex condition, and doctors often find it difficult to detect cases like hers. Just to explain a little more about what's going on, as the brain grows, it needs to be able to push out on the skull bones, pushing them apart to make room for it to grow. If there is a fusion in the suture, then the growth is restricted and the brain is squeezed. So that produces a condition we call intracranial pressure, which can be painful.
So, what are the options?
Well, we've got to reduce that intracranial pressure. The only way we can do that is with surgery.
Surgery? That sounds really dangerous. My pediatrician said it could be fixed with a molding helmet.
If the sagittal suture hadn't fused, then a molding helmet might work, but it's too late for that now. Every surgery has risks, especially head surgeries. She's healthy otherwise, and that's a good thing. That reduces many of the risks. We'll double check to make sure she doesn't have a heart or lung condition, which might get in the way.
I'm really concerned. What exactly will this surgery involve?
Well, there are two options. You can go with the traditional approach or the minimally invasive procedure. With the traditional approach, we go with an incision from one ear all the way to the other ear across the top of the head. It's usually the only scar. Hair usually hides it. Once the incision is made, we remove the affected areas of the skull. We create an opening for the brain to grow. We reshape those bones, place them back in a normal position, and after we're finished, the incision is usually closed using dissolving sutures.
This sounds really difficult.
It's complicated. It requires the expertise of a lot of specialists.
If Jenny has this surgery, do we know that she'll be without pain afterward?
There's no guarantee, unfortunately, that the condition will be completely gone after surgery. Some children continue to have some pain that we can control with medication. And with some children, there's a possibility that we'd have to do a second surgery, but that's very rare because the success rate is very high. It's usually 98% or more. We've been doing this for many years very successfully.
Sorry for so many questions. I just want the best choice for my daughter. After all the bad experiences, I want to be sure. So, what about the other procedure, the minimal one?
The minimally invasive procedure is endoscopic, and we normally perform that when the baby's young, like 6 months or less. We use an endoscope to open the suture. It only takes about an hour. She has to stay one night in the hospital, can probably go home the next day. It's a much simpler procedure, but it can be equally successful when the baby's very young.
Okay. She have to wear a helmet?
Yeah, she'll have to wear a helmet for about 6 months after that. We would have to check in about every 3 months to make sure that the sutures weren't closing early, but otherwise it's
Is it painful, the helmet?
No pain. The helmet's custom made, and success of that procedure is determined by how consistently the helmet is worn.
This is so overwhelming.
Yeah.
How do I decide what's best for Jenny?
It's a lot to think about.
So you're sure she needs surgery? The helmet alone won't work?
Yeah, there's been fusion which has to be corrected surgically. There's no other way around it.
Okay. How do I get more information?
Well, you could probably ask your pediatrician.
This is very stressful.
Yeah. It's a lot to think about. Let me give you a brochure that has information about craniosynostosis and treatment options.
Okay, thank you.